Patients need to come in every 3 or 4 months, more frequently in the beginning as we're first starting the therapy, so that we know that patients are tolerating it and the medicines are working. But once stable, it's every 3 or 4 months to see how you're doing, have blood tests to monitor for the efficacy of the medicines, and just for checkups.
Talk to your doctors, use your resources. Like I said, through a process, and it's a process, like I said, I was coming every 3 months, then we went to every 6 months, and in those appointments, I learned that this is what's going to save my life. And all it is just showing up, getting checked out, checking where your numbers are, knowing what's going on with your body. And the only way I can find that out, I can guess anything, but I'm not a doctor, I don't know, is to go to my appointments, show up, ask questions, listen to what they have to say. They've done the research. They see a whole gauntlet of people. So, from the beginning, I put my trust in my doctors.
As far as HIV monitoring, what we usually like to do is see you every 3 to 4 months and check. Well, first of all, if people are on medications, we want to monitor you and make sure that the medications are working, that they're keeping your virus undetectable, and that your CD4 or T cells are stable or going up. If you're not on medications, we like to also make sure that your disease is not progressing and that you're not getting to a point of having AIDS. And we also monitor, another thing that we monitor is your liver tests and your kidney tests, your urine, your blood count, because HIV can affect all of those, and some of the HIV medications can also affect your liver and your sugar and your cholesterol and things like that.
So generally we say people need to come in at least every 3 or 4 months if they're doing well. And people who are having more struggles or are newly diagnosed, we sometimes see them on a more frequent basis, maybe every month in the beginning, or every few weeks, just to kind of see how things are going initially. So there's always a number of blood tests that we do at every visit, just to check the different HIV lab markers and see how your disease is progressing. And we also talk about all the things that I mentioned previously about your disease, about side effects, about any other concerns or questions that you might have.
There's some routine blood tests that are done, as I said, every 3 or 4 months. The kinds of tests are, the two main tests for HIV are the CD4 count and the HIV viral load. The CD4 count is a measure of the immune cell that HIV likes to infect the most. When the normal value for that is 800 to 1,000, and when that count drops below 200, that's the definition of AIDS. So when a patient gets started on medicines for HIV, the expectation is that over time the CD4 count will rise, hopefully into the normal level, but at least over 200, and depending upon, of course, where the starting point is. So that gets checked every 3 or 4 months. In addition, the other test is a viral load test, and that tells us how much HIV can be detected in the blood. And that test is also done every 3 or 4 months once the patient is stable on medicines. And the goal is for the HIV viral load test to be undetectable. The limits of detection of the test are about 75 or more copies of the HIV gene. And so we're looking for it to be less than 75, and that would be the goal.